this is Dr. Shweta Patel, and I am here to remind you about October being Breast Cancer Awareness Month, also what I like to call Boobtober, because it's all about the tatas. So why is breast cancer so important to be aware of? Well, number one, it's the most common cancer that affects women worldwide. That's kind of a big deal. And number two, because it is a cancer that has an improved outcome if it's detected early on. Prognosis is significantly impacted when it's detected in its early stages or pre-cancer stages even. And so pretty significant value in following screening guidelines and doing what you can to reduce your risk factors, identify your risk factors, and to be aware and participate in routine screening. It is definitely one of those cancers that gets a lot of social attention because of the fantastic campaigns that have been done with regards to breast cancer awareness. And everybody knows breast cancer is the pink ribbon. And so donning that pink ribbon shows that you are aware and are supporting those that have either been through the battle, fought the battle, survived, or have fought the battle and beat it on a more permanent level. And if you have any family member or friends close to you, you can probably empathize with how significant of a challenge that breast cancer can be in terms of your quality of life, in terms of how it truncates a woman's life even in her early prime years of as early as 30s or 40s. And it can be something that affects the entire body once it does start in the breast tissue. So without any more of that background, why do we use early detection as a important tool? Because it's something pretty simple that we can do even in our own homes. What I'm talking about is breast cancer self-breast exams. And it's something that most women don't realize the value in because it doesn't seem very scientific. It's like, oh, okay, I just grope myself and feel around. But most women are probably they're most likely to detect a change in their own body before even a doctor can, before it's even palpable as a mess. And so just the feeling, and I can say this with pretty strong confidence because I've had so many patients that have come with just a hunch, and they felt like they were not being taken seriously because they weren't meeting any criteria based on age or based on risk factors, and they still wanted to get some kind of an evaluation done. And just to out of respect for their concern, kind of bend the rules in, went ahead and ordered imaging tested or studies, and sure enough, they weren't wrong. And so relying on that self-awareness is crucial, and it's free. So other ways that we screen for breast cancer outside of the routine self-breast exam is, of course, a breast exam that can be done when you are at your doctor's office, or if you're doing a virtual visit and your doctor is someone like me who will show you on your virtual visit how to do one. I will not demonstrate it here just in case Facebook decides it's too graphic, but imagine that you are just, kneading through dough and you are kind of feeling for maybe like a pea inside a ball of dough, pizza dough. And it does not have to be any more scientific than that, other than you are looking for that little pea. And if you can't find it, then that's good. And if you are not sure, that's why you have the ability to do the exam with your doctor. Now, other routine screening guidelines, kind of picking up the pace here, include doing your annual breast imaging screening, which is a mammogram, starting from the age of 40 and onwards. And it is recommended by ACOG as something to be done annually, and that's the criteria that I follow. Any woman that is 40 and onwards should have a mammogram done. Don't ask me if I've had mine, because I am going to. I was waiting for this month. Anyhow, There are other criteria as well, but some doctors and some organizations will recommend having screening start at the age of 35, and some will also recommend screening can be as far as 2 years. I personally think that because breast cancer risk goes up as we age, we should be doing more frequent screening, not less, as we get older. And so doing screening annually should be a thing eventually, if not from the get-go. Now, when I say what, breast cancer risk increases with age, well, typically the numbers that I like to quote is that the risk of breast cancer is 1 in 8, meaning 1 in every 80 women will have breast cancer in her lifetime. Now, that's not to say like everybody within the will have breast cancer, like one of them will have it in their lifetime, all at the same time, but the risk increases the longer we live. And so it's a little bit of a morbid thought, but if we all lived till about, 130 to 440, most women would experience breast cancer in their lifetime, statistically speaking. I imagine that when we figure out how to live till 140, we'll probably also have figured out breast cancer, so don't let that make you lose any sleep. Now, so we talked about screening, self-breast exams, and doing the imaging screening in the form of annual screening, at least annually after the age of turning 40 onwards. Other things to be aware of are what are risk factors. So the common ones, obviously, as I mentioned earlier, age. The older you get, the higher your risk. And that's just statistical. So old age is not really specifically the causer of it, as much as it is statistically noted that if you live long enough, you're just around longer, and statistically you're more likely to have things happen to you. One of them being breast cancer. So don't start like lapping on anti-aging voodoo because that will reduce your risk of breast cancer. It may or may not. The other risk factor is obesity. And this goes back to your exposure to estrogen, which is really the risk factor here. Because when you have more fat tissue, those fat cells can actually generate and become a peripheral source of estrogen. It's part of the reason why even men have higher estrogen levels in our society right now, because we all have more fat. And that fat just loves to act as a resource for in-house estrogen creation. And so if you do have, or if you are battling obesity or struggling with it, being overweight, that this should be one more incentive in terms of losing weight, because it will reduce your estrogen excess. It won't just reduce your estrogen levels, it will reduce your estrogen excess and therefore your risk for breast cancer. The other things that will be a risk factor for breast cancer is anything that does expose you to increased estrogen. And this is a little kind of tricky because a lot of women think that therefore they should avoid being on hormonal birth control because that's got estrogen in it, right? But let me flip it a little bit and have you consider this other point of view, which is when you are menstruating every single month, your estrogen levels are actually higher than when you are on birth control. And so being on birth control, it takes a smaller amount of estrogen to convince your ovaries to go on vacation. And that is why being on a combination birth control pill is actually protective against breast and ovarian cancer and uterine cancer. So secondly, having an early age of onset of menstruation. So if you were blessed with like having your period like me when you were 11 or younger, or if you have had a late menopause, meaning like you just kept going until like 60, it overall increases your exposure span to estrogen. Other things that increase your time frame or exposure to estrogen is when you don't have breaks in those years in the form of a pregnancy. So, and this is not promotion of becoming pregnant, or the opposite. It's just facts. Women who have had more pregnancies are at a lower risk for breast cancer, because during pregnancy they are actually taking that time away from their menstrual cycle fluctuations, going up and down and up and down. And furthermore, when they have breastfed, and again, not promoting breastfeeding or taking away from it, and I think it's a personal choice every woman makes for herself and what fits, what works, and what makes her happy. But if you are someone who breastfed with your pregnancies, then you have pat yourself on the back, because you have reduced your risk as well. And again, these are not things that therefore if you didn't do them, your risk is increased. It's just if you did do them, your risk has reduced from your baseline risk. Okay? So we talked about things that are risk factors, so high exposure or more exposure to estrogen in the form of early onset menstruation, late onset menopause, or no pregnancies in between, or if you started to menstruate quickly after having a pregnancy or delivery because you didn't breastfeed. Breastfeeding does sometimes delay your cycle from returning. Age is a risk factor, obesity is a risk factor, and this one was a bummer. Alcohol consumption, I know, those antioxidants, I thought they were working for me, but they do increase your risk of breast cancer. Okay, how do we detect breast cancer outside of the breast exam? So the mammogram is a mainstay, and if there's any concern about your breast tissue, that is the Amazon truck outside, and I'm excited because it's got my Halloween decorations, more of my Halloween decorations. But if you are told that you have something called dense breast tissue, that is not something to freak out about. It simply means that your tissue is a little bit more thicker and less porous, and so it's harder to see through it. Think of it as the difference between looking through a glass of milk and looking through a glass of lemonade. That density in the in the glass of the liquids is different, and I guess more of the opacity would be an easier way to understand. So when you have dense breast tissue, your breast tissue is more opaque and harder to see if there's a tiny bitty little lumps or bump or lesion somewhere. And so there's a higher concern that something got missed. And so they will normally ask you to follow up with a diagnostic mammogram and or a ultrasound. And it's nothing you have to do anything about. It's not like dense breast tissue or dense breasts look better or worse than non-dense breasts. They're all beautiful. And what sorts of genetic risk factors contribute? So if you have a family member that is a first-degree relative, or if you have a family member that is a first-degree relative and or under the age of 50 when they were diagnosed with breast cancer, those should be little red flags for you in your head that you need to bring this up to discuss with your local doctor, because those may increase your risk enough to qualify you for genetic screening and or to do earlier screening in the form of mammograms for you. And why do we look for that? Well, the familial risk of breast cancer or the genetic risk for breast cancer comes usually from the mutations with BRCA1 and BRCA2 genes, or the BRCA genes, also known as the Angelina Jolie genes. And in that was the one celebrity who did have those gene mutations, and she was tested for them because her mother suffered from ovarian cancer. And BRCA1 and BRCA2 increase your risk for breast cancer and ovarian cancer respectively. They increase your risk for both, but BRCA1 is associated with an increased risk for breast and BRCA2 for ovarian. So when her mother was a first-degree relative with ovarian cancer, she was tested and identified, and So was Angelina Jolie, and therefore this is public knowledge, but sorry if it isn't, she did undergo a prophylactic mastectomy and oophorectomy, which is the way to avoid developing cancer when you have a high predisposition because of a genetic mutation, because you remove the tissue source where that cancer can happen. So, something to look into if, again, you have a family history. Your conversation typically should be going on in this form. How old are you? Do you drink? Are you overweight? Have you had babies? When were you, how old were you when you started menstruating? Are you going through menopause? Were you on birth control? Were you breastfeeding? Do you drink alcohol? And, of course, do you smoke? And, I think I said already, were you on birth control? And then do you have any family members who have had breast cancer or under the age of 50 at the time of diagnosis? These are all going to be ways to figure out whether you need to get something done sooner rather than later. Otherwise, every woman should have her diagnostic mammogram and self-breast exam done annually at the onset of age 40. And for the self-breast exam alone, you can do that whatever you want. Ain't nobody gonna stop you. You could pretend to do it at breast exam. I hope you do. Go ahead, girl. All right. So if you want to have more information on this, of course, you can always go to the resource hub that is GAYAwellness.org, and we have completely upgamed or up-leveled or leveled up our website. So please take a look and stop by our blog area and our YouTube channel, and really just even our Facebook forum and group pages, which will all be a great place for you to ask questions, learn more, and if you would like to make a virtual consultation with me, you can book your visit through the website. And you can also visit the breast cancer awareness organizations, or just go to nationalbreastcancer.org for more information. And I'm pretty sure there's going to be some buses going around in the month of October for more discounted mammograms for any of you who do not have access to health insurance that's affordable. You can still get screening. Usually they are around $40, which is manageable for most people, especially considering the cost of the disease itself if it's not detected. So thank you for listening, and I hope this was helpful. And let's get this Boobtober going. Take care.